Welcome to Dental Brain Crops. I'm your host, Chelsea Myers, and this is actually really exciting for me. I've got Dr. Amanda Wilson with me today, who I was connected with back in 2015 when I partnered in my very first practice. And so, Amanda, this is so exciting to meet in person and be here today.
I love it. That's the best part of the dental festival.
Meeting in person, absolutely.
Yes.
So you're an orthodontist, but it's not what you do. It is, but you don't practice in the practice right now. You're using your knowledge in a different way, and I'd love to just hear a little bit of your background and how you got from practicing to what you're doing now.
Sure. I'm so glad to tell this story, and I think for a lot of females or people who've actually married their spouse who's also a dental professional or a medical professional, you can kind of empathize with this story. So I'll tell you like the 2-minute version.
Yeah, please.
So I graduated from residency, University of Connecticut, 2004. 2004. I had to think about that, right? I can't believe we're already 22.
I know.
So 18 years ago, did the normal like work in a practice thing. I had my own practice. I had a group practice for about 10 years. And then in about 2008, 2009, there was a big downturn in the economy, kind of like what we're experiencing right now. So I kind of feel like I've already been through this. I'm like, okay, it's all about pivoting whenever you're in a recession. Right. It's a great time to think about doing other things. So what happened was there was a general dentist down the street from my practice that put up a billboard saying Invisalign $29.95. And I was charging about $7,000 at the time. Because back then there weren't that many providers for Invisalign.
Right.
So that was like, whoa. I'm like, oh, nobody's going to go to this guy, right? He's a third of what I charge, a little more than a third of what I charge, but they're not going to go to him. He probably doesn't know what he's doing. Well, guess what? They went to him, and I lost a lot of patients, and it was a big hit on my practice. But, I kind of picked up my ego off the floor, and I went to go talk to him. And I said, hey, whoa, what's going on, And he said, look, doc, I'm not trying to steal your patients. That's the last thing I'm trying to do. Mm-hmm. What I'm trying to do is I'm trying to get patients for implants. Okay. And that for me was like, what? You're not even really interested in the ortho. He says, yeah, I'm just trying to line up teeth so I can do more implants and do more restorative and do more veneers. I bundle the price. So I keep my price low on purpose to try to bundle it. So I'm getting $20,000 treatment plans. He goes, it's really not about the ortho for me. And I was like, oh, okay, I get it. And then I said, you know what? I'm going to start changing my whole philosophy. I'm going to start helping general dentists because I'm really good at explaining things and taking difficult things and breaking it down and explaining things. I probably could have been a teacher, but it wasn't my thing. But I love to teach about teeth. So I started befriending the general dentist. And of course, my husband's a general dentist. So, and that little side hustle started to grow. And my husband at one point said, hey, you're pretty good at this. It's bringing in some revenue. Why don't you just step away from the practice? And for us having a couple kids, at the time they were school-age kids, I felt like I never saw my kids. Mm-hmm. Ortho is one of those practices where you are super busy on weekends. There's no way around it. You are super busy late afternoons and evenings. Right. And when you have school-age kids, you're never going to see them. Mm-hmm. So I decided to go full-time into consulting and product development, which was like a huge leap. We moved back to Hawaii, where he was from, to spend more time with family, to cut costs. I know that sounds crazy, but we do that in Hawaii. Yeah. We help out each other, and that's pretty much how things are.
Well, first of all, I have to say you are a really good teacher. If you haven't seen her content, it's all over the place. But YouTube, there's a fantastic YouTube channel with like literally hundreds of videos.
Actually, 6,500.
6,500. Okay.
Almost every day I add a video. I mean, some of them are bad, some are really, really good. But, I try to constantly add content. But, listeners and subscribers give me suggestions, like teach me about this. Yeah. And for the most part, it's meant for dentists to learn more about ortho in a simple way, but a lot of consumers listen to it too.
Mm-hmm. Mm-hmm. No, I loved it. And so, okay, so tell me, what would you, if I'm a dentist and I want to learn more, or an orthodontist and I want to just learn more about how to implement these things into my practice, where do I start?
Yeah, sure. So, I mean, I really, especially during COVID, I was kind of bored because part of the model of my consulting practice is that I'm month to month. So I don't want people to be stuck in a year-long contract. There's nothing like that. So I lost a lot of business during COVID, which was fine. It all came back. I was fine with that, but I was bored, right? I'm one of those people that can't sit around. Yeah. So some people were out exercising and taking up new hobbies, and I was like, I'm going to make YouTube videos. So I started making a couple YouTube videos a day, and that added to the library. So actually, you can learn everything you need to know from my YouTube series, which is totally free. There might be an occasional ad. Mm-hmm. Yes, it pays for my Starbucks, and that's about it. You don't make that much money off YouTube, let me tell you, unless you have bazillion subscribers. Uh-huh. But it's all available. Any type of ortho, it's up there, from braces, straight wire, bracket placement, any type of aligners. I have no particular affiliation with any aligner company. Phase 1 interceptive, airway, you name it, it's all there. So it's all developed into individual playlists, or if you want to get the playlist directly, I have them on my website at StraightSmile Solutions.
Okay, so start with the YouTubes. Figure out what you need to know from there.
Yeah.
Okay, and then I know you gave a really interesting presentation yesterday. People have been talking about it, so tell me about that.
Sure. Yeah. So the topic of the presentation, it was with Action to Win, Dr. Emily's lecture, and the topic was how you can add $100,000, 6 figures to your revenue in just 6 months without investing in anything.
Yeah.
And you can. I've seen it happen. Now, the disclaimer is it is easier if you do have a scanner of some sort, even better if you have an iTero. And trust me, I don't work for Align Technology, never will, never have, but it is a great scanner for ortho. It just is. So if you have some type of scanner, we can make it happen. It's a little more difficult to do that without a scanner. I think it's hard to scale.
Okay, so just bullet points. How do you create 6 figures in your practice in 6 months?
Well, the easiest way is to scan every single patient in your practice. And I like to say, hey, 20 years ago, we were barely even probing patients, and we certainly weren't doing oral cancer screenings, well, maybe just starting to, about my year. And now I recommend scanning every patient, or you can take photos. It's fine, too. You can take a series of photos and just going over what you see with the patient and what things would benefit with orthodontics. You don't want to say, hey, can I do an ortho exam? Because as much as that's nice to ask for permission or consent, it's not about that. It's actually about informing the patient about their occlusion and their bite and how we could improve it, and perhaps how things are happening because the bite isn't balanced. So, I really recommend the scan should only be taking a minute or two, depending on your scanner, and you can save it. It's really powerful to have scans saving that data, because later you can go back, and reference it when they come back, and do this every 12 months. They come in, maybe you do it opposite the perio probing, in the hygiene appointment, and just make it standard in your office to have that scan done, store the image in the cloud. The cool benefit is that a lot of times, and even during COVID, when we started doing this in my husband's practice with his iTero, during COVID, when all of a sudden things shut down in Hawaii, he was able to literally send his team in. They had possibly thousands of scans banked. They could call patients, even though they couldn't come in. Hey, did you want to get those retainers? Or did you want to start that Invisalign? Or even other types of restorative things that were, because the scan was already there, so they were making production just virtually.
Right.
It's really powerful.
Right, and you hit on one of the questions I was going to ask is, when we're moving so fast-paced in our practices, what is the time constraint of this? But if it just becomes part of the routine that you take a scan,
it has to become the routine,
and you're doing that, you're already in the mouth, so you do the oral cancer screening, and so this doesn't have to be something that's majorly time consuming, but now you're able to talk about the aligners as well.
And the scripting that we use in my husband's office is he feels pretty confident for the most part, because he's been doing ortho now for about 15 years. But if he's not sure, his scripting is, or even if he doesn't get a chance to see that patient, if the hygienist does a scan or the assistant does, they tell them, hey, doctor likes us to scan every patient because he likes to study your bite. He does it outside office hours because he likes to take a little more time. We're going to give you a call back sometime, either next Monday or Tuesday. Expect a phone call. Or if you'd like, you can schedule a virtual Zoom session or a phone call with us to go over the results of your bite screening. Yeah. We say bite screening. You can use other terminology as well, but it's not orthodontic exam, because adults are thinking, ortho, I don't want ortho, braces.
Right.
No,
Right.
And you'd be surprised. All you're doing is educating them on what you see. So you can say, hey, I see abfractions on this tooth, and I see attrition on this tooth, and I see some, we have some perio on this tooth. It is possible that if we did orthodontics, we could balance this bite better, and it could stop the progression of disease. That is our goal. We want you to keep your teeth for a lifetime. That's all we say. If you're interested in hearing more about ortho, we can either refer you out to an orthodontist, or we do some services in-house. That's all they leave it at, and a lot of times patients are like, oh, I'm not interested right now, but you'd be surprised how many say yes. And then often when you repeat 12 months later, show them how the progression of disease has gotten worse, all of a sudden they wake up and they're like, wow, an implant is way more expensive than me just getting some easy ortho right now and just balancing things a little bit more.
Right. And so 2 things. One, if you don't ask, they can't say yes.
Don't ask, don't get.
And secondly, an immediate no is not a permanent no.
No. Yeah, exactly. And don't be salesy. That's the main thing. We're never salesy in ortho.
Right.
We just talk about, ortho's a little different. For an orthodontist office, most people come in because they're expecting to get ortho. But it's different in a GP office. You don't want to push too hard. If you're pushing too hard, that's probably your mistake.
All good things. Hey, tell me about your book. I'm so excited about this.
That was another COVID project. A lot of us wrote books. So it was just a series of blogs that I pieced together just to make really easy reading on how you can just implement different types of ortho into your practice. Super simple, easy reading, easy breezy. It's affordable. You can get it on Amazon for just, I think, $9 if you want to do Kindle or something like that. But I think it's a great read. It's a great way to get started, just to get you motivated as what's possible in a practice.
What would be a good first step if you have a general practice and you think that you want to implement some ortho, but you're not sure, you don't want to dive all the way in? What would be something that's not super expensive or, time consuming to figure out?
Personally, I love interceptive phase 1, and that's probably the one the least that dentists do. You know, even a lot of orthodontists don't do phase 1 treatment, which is early treatment. I love working on 5 to 8 year olds. They're just so easy. They're so fun. You can do all removable appliances, and if you do all removable appliances, your team can do everything. All you're doing is the treatment plan. So, you're doing the diagnosis and treatment plan, but in terms of the actual execution, it can be done by your team. So all you have to do is find that one team member who loves working with kids, school-age kids, and there's always somebody who's very good with kids. That's your person, and then this can be an additional revenue builder for them. Perhaps they're getting a small percentage of the production, or if you hit certain thresholds, they're getting, bonuses because they're owning the program. And I've never seen a case in an office where someone doesn't want to take that up, and it's easy. Expanders are super easy. Don't be afraid of them. Growth modification is really easy. You can put glitter and glow in the dark. And I've never had a kid. I mean, it's really about the parents. If if the parents are easy to partner with, then the kid will be fine. You know, they're always like, yes. And I think I told this story yesterday real quick. I don't know how much time you have, but
You're good.
When I was 8, this is my personal story, I made my own retainer in 3rd grade out of now and laters and paper clips. And I wore it to school. And one of my teachers told my mom at the conference, like, oh, wow, she's so good wearing her retainer. Mom's like, she doesn't have a retainer. And that was really my I'm going to be an orthodontist story. Now that I think about it, it was pretty cool. I made a pretty functional retainer out of paper clips and now and laters. But little kids want this. Now, teenagers, they don't want this stuff. They really, really don't. I have 2 teens now, 13 and 16, and the last thing they'd want is ortho. So better to get the hard stuff done when they're little and get it over with.
Yeah, I love what you're saying. Okay, so you mentioned your kids, and so I just want to talk a little bit about that because, when you talk about being able to increase the revenue in your practice and you talk about also having families, it's really important that we figure out what it is that we really want to do in our professional lives because we have so many options. And so when you can create a little bit more predictability on the financial aspect, you can then feel a little bit more free to interact and do the things in your personal life that you want to. Tell me a little bit about your experience and what you're doing now.
I can even tell you even more about what my husband's done since he's a general dentist. So he picked up ortho, sleep, and implants because he was actually the oldest student in our dental school, and I was one of the youngest. So he was like, I can't do this until I'm in my 60s. I can't do this in my 70s. I don't want to do crowns. I don't want to do preps. I'm over this. All I want to do is stuff that has high revenue, easy. That my assistants can do most of the busy work, and I'm just the brains. He goes, I'm jealous of what you do, and so I said, no reason you can't do it. So he started doing that. Now he can buy another practice. His associates do all the bread and butter, and he does the specialty work. He's basically only working 2 days a week, which is like, it's bad for me because he's always home and I can't get anything done, but it's good, It's good because, he is always home and he's a big part of the kids' lives, and he's bringing in decent revenue, and he's really happy. And he was one of those dentists that was like, did I make a mistake going into dentistry? For a while, he was thinking, a lot of people say that, did I make a mistake? I can't wait till I'm done. And now he has a whole different opinion. He loves it because he loves the dentistry that he does. It's the stuff he likes.
And I hear that so often. Did I make the wrong choice? Am I in the right industry? Should I just go be a pharmacist? Should I just go teach at a dental school? All kinds of questions. But what it really comes down to, and it sounds like you guys have both hit on it really hard, is figuring out what is it that I want and aligning that health, happiness, and success, and realizing that all 3 of those have to be in place. And so if you're not, mentally and emotionally healthy, then these other things are going to fall. If you're not happy in your career, you're not going to be successful no matter what your bank account looks like. It's not going to be the type of success that you dreamed of.
That's true.
So
very,
that's
very
fantastic.
True.
And
thank you.
Yeah, thank you so much for sharing this. And if people want to reach out to you, StraightSmile Solutions, how would they?
Just go to the website, and there's a button on the Contact Me where you can schedule a complimentary consultation. It just says free call, so click on that. It's 20 minutes. We can talk about anything we want. We're not going to be specifically looking at cases because there's some liability issues with that we have to sort out with some paperwork first before we do that. But we can talk about ortho, talk about your concerns. I talk about all kind of things when people call me, and that's what it's available for. Any dentist is welcome to schedule, or even dental industry professional.
Perfect. Well, thank you so much, Amanda. This is a lot of fun.
Thank you. Nice to see you.
Have a